A woman, 51 years old, first consultation on May 7, 1960. Her menstruation had stopped 3 years earlier. Half a year ago, she occasionally experienced vaginal bleeding with a small amount. Without treatment, after 1 month the condition worsened, bleeding continued, pale in color, mixed with clots, sometimes with pain in the lower abdomen below the navel. She had taken some medicines but without effect. Her body became thinner and she came again to see the doctor. The patient's face was pale, with heat and restlessness in the palms, soles, and chest. Every afternoon she experienced tidal fever, dryness of mouth and throat, and constipation. 7 years earlier, she had 1 miscarriage. Her tongue was light red with a thin white coating. The pulse was thready and choppy. The doctor considered that the patient had blood stasis and deficiency of warming energy and prescribed Wenjing Tang as the base formula. Prescription: Evodia fruit, Uju Yu, 9 grams, Chinese angelica root, Dangi, 9 grams, Chuansheng rhizome, Chuansheng, 6 grams, white peony root, Bai Shao, 12 grams, Capatonopsis root, Dangshen, 9 grams, cinnamon twig, Guiji, 6 grams, donkey hide gelatin, Jiao, 9 grams, melt with heat, then pour into the already decocted herbal liquid and mix, mutan bark, Dan Pi, 6 grams, Pinelia rhizome, Ban Xia, 6 grams, fresh ginger, Shangjiang, 6 grams, honey fried licorice root, Ji Gan Gao, 6 grams, and Ophiopogon root, Mai Dong, 9 grams. This was the daily dosage. The herbs were decocted in water, and the liquid was divided into 2 doses per day. The doctor prescribed 7 days of medicine. After taking it, bleeding and fever were reduced. The doctor slightly adjusted the prescription according to symptoms and asked the patient to continue. After 20 days, bleeding suddenly increased, with dark purple clots, blood color varied, and abdominal distension appeared, sometimes light, sometimes heavy. The family was worried. The doctor felt her pulse, which was deep and slow, requiring pressure to detect. The rate was normal. Symptoms of fever, dryness of mouth and throat were greatly reduced. The doctor considered that both the pulse and the symptoms were improving. The increase in bleeding was regarded as a good sign, indicating that the body's zheng qi was recovering and pushing the stagnant blood out of the body. He advised continuing the same prescription for 6 more doses, taken every other day. After taking the medicine, clots were expelled for 5 days, then bleeding decreased and abdominal distension and pain disappeared. With the same method and prescription for another 5 doses, bleeding stopped completely. Constipation remained but was milder. The doctor prescribed Ma Ren Run Chang Wan for 2 weeks, after which she was completely cured. Follow-up for 10 years showed no recurrence. Note: 1. Wenjing Tang is the name of a classical ancient herbal formula. Ma Ren Run Chang Wan is the name of a modern herbal formula. 2. Zheng Qi is a term in traditional Chinese medicine referring to the body's ability to maintain normal physiological activities.